Hi, my name is Tracy Matino, and I'm a certified fitness instructor with a passion for Pilates. I've been teaching for 13 years and have recently been certified as a breast cancer exercise specialist through the Pink Ribbon Program. The Pink Ribbon Program was created to enhance recovery for breast cancer patients. It is a staged process that will help stretch and strengthen the chest, shoulders, and back, and help promote range of motion in those areas affected by surgery, treatment, and recovery. The program can begin 6 weeks post-op or after your surgeon has given you the okay to do therapeutic surgery. The exercises can be done 2 to 3 times a week and is for any fitness level. Benefits of the Pink Ribbon Program are enhances and restores energy levels, promotes lymphatic drainage, which can lead to lymphedema, assists in restoring posture, alleviates pain and swelling, improves quality of life, and decreases stress and anxiety. For more information, you can go to www.pinkribbonprogram.com, which will also give you a list of instructors. We will begin the exercise portion now in a standing position. We're going to begin in standing position, and we're going to just work on our breath. Breathe in through the nose and out through the mouth. And as you're breathing, watching that you're not elevating the shoulders with each breath. Inhale and exhale. I want you to think of breathing more into the ribs or into the armpits. And maybe you need to put your hands upon your rib cage as a little reminder. So let's try to inhale and exhale. So feel that breath come into your fingertips. Give me one more inhale and exhale. Good. Well, let those arms relax by your side. Take a comfortable stand apart. I have something on my pants. You're going to take a comfortable stand apart, a little bit wider than hips or just under the hips. And we're going to start to shift our weight over to the right without lifting your left foot up. And then come back into center, and then we'll shift over to the left and back into center. So we'll continue that a few times. And as you're shifting, just making sure the feet stay grounded. And just a nice easy breath as you're moving side to side. And we'll do one more each way. And coming over to the left and center yourself. We're going to keep the position. We're just going to start to circle around. So we're going to start to shift your weight around into the back and back to the front. So just noticing where your feet are gripping on the floor and where there may be some lightness in your feet. Now, if you can do this exercise in bare feet, you'll get more feedback from the muscles in the feet. So that would be something you should try to strive for. And let's reverse the circling. So in these exercises, you actually don't need to be wearing shoes for what we're going to be doing. You can be in socks if you wish, but bare feet really would be preferred. So just shifting that weight around. And then we'll come back into center. Now we're going to begin our seated portion, so we'll grab a chair. Okay, so get yourself comfortable in a seated position. And there are backs onto our chairs. We're trying not to rely on sitting back. You're trying to help your posture by sitting up tall. If you do need the support, of course, you can sit on back. So I'm just sitting, feet are flat on the floor. And we're going to start with our head tilting to the right towards the shoulder. It's not shoulder to ear, it's ear to shoulder. And then coming back up and going over to the other side. And back on up, and then tilting chin towards chest. And back on up. Again, we'll repeat ear to shoulder, not shoulder to ear. And you may find that one side feels a little more stiff than the other, but that's okay. And then chin back down to chest. And lift back up. We'll do that one more time. Ear to shoulder. And back up. And ear to shoulder, just trying to stretch through that shoulder area. And back up. And then chin back down to chest. And lifting back on up. We're going to do some shoulder rolls now. So you can take your hands off of your legs and just start to roll those shoulders to the back. So we're going to pick them up and drop them down. Now, I only like to shoulder roll to the back because I feel that within our everyday lifestyles, our shoulders are often forward, whether we're working on a computer, driving, cooking, looking at our phones. So they don't need help going forward. They need help going back. So you'll lift and drop down, lift and drop down. And let's just do one more. Lift and drop down. We're going to float those arms up about chest height, again, without elevating shoulders. You always want to check into that. I want you to draw those shoulders back and feel as if you're connecting your shoulder blades in the back, and then reach out as if somebody's grabbing your fingertips and pulling those shoulder blades apart. And then slide those shoulders back. Again, it's really easy to elevate, so watching that, and then reaching out across the room. And as you reach across the room, you should feel your abdominals are drawing back, so we're actually strengthening our core at the same time. And then draw those shoulders back, and then reach back on out. We'll do one more. Pull those shoulder blades back, and then reaching out forward. Okay, we're going to bend at the elbows, and then have those arms facing each other. I call this goalpost arms. You're going to open and press those shoulder blades together again in the back, and then pull it back together. Not rushing through the movement. We want to resist this, especially as it's coming back forward. Watching as you push open that you're not thrusting the chest and ribs out. I want you to think about not arching the back as you do that. I want you to think of keeping a strong center. Let's go two more. And shut. And last time. Open and shut. And we can relax for a second. Sometimes it gets a little tiring, so just want to shake it out. We're going to establish genie arms, so stacking one arm on top of the other. We're going into rotation. So if you were leaning back for a little help, try to sit up tall for this one. We're going to start to rotate to the right. So we're going to move those arms, turn the head with it, and then come back into center. And then we'll go to the left and come back to center. You're going to try to take an inhale here and exhale as you twist. And inhale here and exhale as you twist. And as we're rotating here, you're rotating from your waistline, not from the hips. So I want you to imagine that from your hips down, you're cemented onto that chair and it can't move. So sometimes when people rotate, they end up moving the hips and the knees. So then you're just kind of going with the movement. You want to keep it just working from that torso. And let's finish up going to the left and coming back to center and relaxing. We're now going to take our exercises down to the floor, whether you need a mat or just are on your floor. And some of you may need to prop your head on a pillow because sometimes people feel dizzy or nauseous laying flat on the floor. So feel free to grab a little bit of a pillow if you should need that. So we're lying down on the floor. This is called a supine position. Feet are flat, knees are bent, arms are resting down by our sides. And just kind of relax and reorganize for a second. We're going to start to slide those arms out to a T position. Then once you get there, you'll flip your palms up and start to move those arms overhead as far as you can. And then you'll start to slide the arms back into the T, flip the palms back over, and start to come back in. Again, we start to open up to T, flip the palms up, circle overhead wherever it gets to. Watch that you don't arch off the mat. We want to keep thinking of those back ribs pulling down so we offer protection for the back. Start to slide back to T, palms face down, slide back in. And let's do it again. Out to T, palms face up, overhead you go. Arms come back, palms come down, and come back in. Now the next movement, I just have to caution, if you've had lat flap surgery, you're going to move one arm at a time for this. Otherwise, you can do both arms. So both arms are going to start to lift up and over. Moving slowly, seeing where you can get to. It's not a problem if you're not reaching the floor. You're just going to where your body's allowing you. Bring those arms back up and float them back down to your side. Again, so we lift up and over, moving slowly, seeing how it feels, seeing where you may be tight, and then lift those arms back up and bring them back down by your side. Again, please watch as your arms come up and over that you're not arching off of your floor. And then bring those arms back over once again. All right, so let's relax here. We're going to take one arm up, one arm down, wherever they reach to. And I want you to feel like you're reaching your fingertips in opposite directions. And then those arms will switch position. And same thing, you're going to slide and reach. You're trying to create length in your side. And then up and over. And slide away. And slowly moving to switch position. And slide it away. We'll do one more each side. Reach and slide. And last one. Reach and slide. And then come on back in. All right, arms rest down by your side. You're going to lift your forearms up and keep your elbows onto the floor. Let's start with the right going back and the left going down. So they're moving in opposite directions, but the elbows stay in contact with the floor. And then you'll switch. So just again, kind of just noticing where you're getting to. There is no contest, no specific place we've got to get to. You may want to play with how close or far apart your elbows are in relationship to your body, so feel free to experiment with that. And up and down. And one more each way. Good. And then both arms can relax down by your side. The next position is called bridge. We're going to stay in this position. You may need to adjust where your feet are. I like to walk mine in. You can play with this too. Bridge is about lifting our hips off of the floor, lifting as high as we can. It's about strengthening the underneath of the body, strengthening the backs of the thighs into the hamstrings and into the glutes. And then we'll place ourselves back on down with control. We don't want to just flop. We want to control that movement coming down as well. Press into your feet, lift back up. Check in at the top here. Are my knees rolling out or in? Am I pressing into the big toes? And then lowering that bridge back on down. And then we'll do one last one. We'll lift that bridge back on up. Take a breath at the top and exhale as you lower it back on down. All right, we're going to finish in a seated position on the floor. So you can either turn to the side to help yourself up or rock on up. So whatever feels good for you. This last position, you're going to take a crisscross legged position. If this is not comfortable, you can try a butterfly. You can sit with legs long. You can grab your chair again and sit in that chair. So we're going to take our hands into prayer in the center of the chest. We're going to start to send those arms up to sky. And then pull those hands back down to center of chest. So I want to feel the energy of those hands pressing together as you lift up. And slide back on down. Let's inhale to lift up. Exhale to slide back on down. And we'll go one more time. Inhale to lift up. And exhale to slide back on down, right into center of the heart. Thank you for joining me. Be well.